All right. Welcome, everybody. Everybody. I'm so excited about tonight for so many reasons. But let me first start by thanking everyone for showing up. One, two, do me a favor. This is a massive educational event. And so if you have an opportunity or you know someone who could use this, throw it out there, share it. The more you share it, the more education gets passed on to everyone in the world. And that's what we're trying to do here. So thank you for doing that. Thank you, Philip Keeling, for setting this up and bringing me to the Susan G. Komen Foundation, which is our guest tonight. And I'll talk more about that in just a second, which I'm really excited about. But you guys know what this month is. This is Breast Cancer Awareness Month. And if you've know anything about me or my family, it's a very, very, very personal thing to me. Not only am I a breast cancer surgeon and have treated thousands of women with breast cancer and men, but breast cancer runs in my family. It runs in the men in my family. Many men, including my twin brother, have had bilateral mastectomies in my family. And I've performed hundreds and hundreds of operations for this. So this is why it is dear to me. And so if you couple this with the foundation in the world that is the #1 foundation for breast cancer research and funding in the world, I am honored to be here with them tonight. I want to list a couple of facts about breast cancer, and then I'm going to introduce my guest tonight, who knows probably more about this and the inequities in breast cancer, which is exactly what the topic we're going to touch on. And we're going to go with that. All right. #1. Breast cancer facts. These are things that everyone should know. So remember these things. 1 in 8 women will get breast cancer over their lifetime. This is not something small. In fact, people tell me all the time, it's 13%. It's 13%, Dr. Radicky. Let me tell you about 13%. Let's just say it was 10%. Here's the deal. If you went to Vegas and somebody said, hey, if you bet on black right now, you have a 90% chance of winning. You'd put your entire wallet and banking account on black. But the opposite is also true. If you were standing in a hallway with 9 other women and a guy with 1 bullet and a gun was standing there, would you not be sweating? That's my question. You would be sweating because that 10% is real. This is real, and you either know somebody or it affects you personally or it's in your family. That's how real it is. And did you know 1 in 833 men will get breast cancer? And in fact, the World Health Organization says it will be the #1 diagnosed cancer in the world this year. So this is how prevalent it is and how predominant it is. Oh, we have guests. All right. So did you know that 287,850 new cases? Come here. Come join us. Come here. The puppy wants to get in on this. All right. 287,000 new cases of breast cancer just in 2022. And that's just women in the US. That doesn't even include the 51,000 of non-invasive breast cancers that'll be diagnosed. And here's a number that we don't like and we're trying to change. And that's what we're going to talk about tonight. 43,250 women will die in the US this year from breast cancer. And that doesn't have to happen, especially in the minority communities. And that's something I want to talk about tonight. So I want to introduce Dr. Omatola Gordon-Rose, who has been doing this forever and ever and ever. So will you tell us a little bit about yourself, and thank you for coming tonight.
Thank you, Dr. Rad. I'm excited to be here to talk about this incredibly important issue. And I'm Dr. Omatola Gordon-Rose. I am the Senior Director for Health Equity Initiatives at Susan G. Komen. And my work involves developing and implementing and facilitating Komen's collective racial and health equity strategies throughout our work. My focus primarily is to serve the Black community and to also address those needs of people from racial and ethnic minority groups that are living in the rural areas and medical deserts and communities and under-resourced and that have limited access to resources to help to address disparities and to advance health equity in the breast cancer space. So I'm so excited to be here. I've been in this work for over 16 years, and breast cancer has been near and dear to my heart. Addressing social determinants of health and in populations that are that have unmet needs, not just chronic diseases, but also infectious diseases. So I'm so excited to be here to talk about how we are advancing health equity at Komen and the work that we're doing through our stands for H.E.R program in our communities. So thank you so much. I'm excited to talk more to you about this.
That's awesome. It's when I found out about your stand for H.E.R, and we're gonna get to that. That's what I want to spend the meat of our conversation on. But when I found out about that, I was just blown away, right? Because I know lots of things about the Susan G. Komen Foundation. It's the most prevalent breast cancer foundation in the world, right? I mean, you guys have donated over $1.1 billion to research, right? That's where it's really at. But then you did other things that no one else has done. You thought of everything. You connected 30 million women on one platform to just be connected together, to share in the experience, because it is a tough experience not to be lived alone, right? You guys, 200,000 in just financial aid. It goes to women who just don't have the capability. You're hitting it on every front, and I appreciate that. So I want to play a game of truth or dare. Actually, it's a lot. True or false. All right, true or false. And I want you to play with me.
Okay.
And I'm gonna cheat. I'm gonna give you the answer.
Okay.
The answer is true if you agree with me, and then I want you to tell me why.
Okay.
All right. I'm going to read you what I think is a fact, and you're going to tell me if you agree or not. We have seen a major decline in breast cancer. That's true. At least the mortality rates associated with breast cancer since 1989.
Yes.
Yet shockingly, the overall mortality rate has shown a massive disparity between Black and white women. Is that true?
True. Yes.
All right. Expand on that for a minute.
So imagine
like a little disparity, like big disparity. What are we talking?
There's big disparity. There's a huge gap because again, Black women in the US are 40% more likely to die from breast cancer than white women. And in some communities, this disparity.
I'm sorry. 4 or 40?
40% more likely.
That's a big number.
Yes. And in some communities, it's high as 74%, depending on the community. And I want people to imagine this. 2 women in the same city in the United States, 1 Black, 1 white, receiving a diagnostic breast service at the same time, right?
Right.
From their healthcare provider. Both are insured. They are the same age. It will seem as though those 2 women should receive the same types of services, right?
Right.
And upon their diagnosis and the same level of treatment. But however, in a healthcare system riddled with inequities, this is not the case for a lot of our Black women. So while Black women are diagnosed at a younger and with more aggressive form of this disease, which biology also plays a role, right? Black women are dying more than white women because the healthcare system has failed them and continues to fail them all across the breast cancer care journey. So in
40%, 40%. This is 2022, Omatola.
I know.
How did this happen? Right? If you were to say to me that of all the Black people getting married in this country and all the white people getting married in this country, it is 40% more likely for it to rain on their wedding day, I would tell you, you're crazy. You've lost your mind, right? Something happened to take us on a path that has led us to here, right? This is 2022 when things are equal, right? But they're not. So how did this happen? I want you to hit on some things. Availability of diagnostics, primary care, education. Throw it all at me. How did this get here?
How much time do we have, right?
Well, yeah, that's true. All right, we can pick them apart one at a time. We'll pick them apart one at a time. So, all right, so availability of diagnostics.
Yes. So this disparity is not just a simple matter of access to those screenings and diagnostics. And it's, as you mentioned, it's like a perfect storm of issues brewing for a
Right.
long time. And it spanned across every aspects of our healthcare system and society at large. So Black women are dying more than white women because, again, the healthcare system has failed them through their journey. Their systemic failures also extend far beyond the healthcare system. And this includes the system that dictates the policies, the laws, the provision of their education, and all these other social determinants of health that affects our Black women. And in response to this, in 2021, we have a report called Closing the Breast Cancer Gap, a roadmap to save the lives of Black women in America. And this study, we focused on the systemic and social determinants of health in these 10 cities, right? We started in these 10 cities that have the greatest mortality rates in breast cancer for Black and white women, as well as looking at those greatest inequities. Okay. And according to this report, we found that Black women are often ignored by their healthcare providers. They face significant barriers to receiving the care that they need, to the legacy of, again, systemic racism, implicit bias, and below standard care. So that is just some issues that is reflected in our report that we found with a lot of Black women reporting.
Sure. Okay, so I keep hearing that the healthcare system, and I will admit, I'm a part of that healthcare system.
Mm-hmm.
Right? So I grew up in it. Now I am closer to 50 than I am 40. So I'm not a baby, but I'm not old, and I get it. But I will tell you, I agree with you. I agree with you on many accounts. The availability of care, the education, the ignorance of multiple important aspects to the care of the Black community has been ignored for a long time. That cannot be disputed. That is a well-known fact. You can look it up on numerous websites. There are attempts to try to repair this. It is a very difficult problem to repair. It's kind of like saying, we're just gonna, fix, a few hundred years of inequities very, very quickly, and that just can't happen. Wow. But you guys are coming up with programs to help with us, obviously, and we're going to talk about that in a minute. But how about let's play devil's advocate. What if I said, well, okay, you keep blaming healthcare, but what about in the home? What about the home of the average African-American person? Isn't there a lack of education? Why aren't they doing more? Are they talking about breast cancer in the home? Do they talk about how your grandmother had breast cancer and you need to get screened? And is that a problem?
That is also seemed to be also an issue in some of our Black communities, where the conversation about breast cancer and health history is not usually talked about, because there's a stigma in talking about any chronic illness in the Black community, right? But also we're able, providing that education will help to amplify that conversation a little bit more in the household. So there are some challenges when it comes to having that conversation about our breast health. And sometimes we don't want to know, we don't want to talk about it.
All right. Yeah.
Speak about it. Does not exist in our communities. But, that's why I said there's so many multiple layers of challenges that are entrenched in these numbers being so high, right? But if those conversations are happening at home, and as well in the healthcare system, and as well as if there's policies that align with what we're doing with advancing these outcomes and helping to better our communities, then the conversations will be more. So I'm glad that we're having this conversation, and that you're a doctor and you recognize that this is also a challenge in your field. And to hear from these women speaking about how, not just in the home, even those who are having the conversation at home, when they're in the healthcare system, it's hard to navigate through the healthcare system. Even if they do have health insurance, even if they have quality health insurance or subpar health insurance, many of them noted that they're met with the same challenges of biases and not being taken seriously of their pain. Like I'm hurting, their pain isn't taken seriously because there's a perception that Black women are strong, they can withstand pain, right? So that is also one of the perceptions that's out there, and we're trying to, no, we feel pain too, we're hurting too, we need help as well, and also being able to have that conversation inside the home and as well as outside to help to advocate for themselves.
Certainly talked about the health inadequacies, which we're going to talk more about.
Mhm.
Talked about some education inadequacies, and I know Komen is attacking that as well. You guys put a ton of information out there. You have hotlines, you have the internet, I've never seen a website so inundated with massive amounts of it's not just information though. It's done in a very colloquial way where everybody can read it and understand it. And if you want more, hey, we got more, and I appreciate that. But you touched on something. I want to hear a little bit more about it. You said policies.
Yes.
What do you mean about policies? Because there's a third part to this, right? Government, insurance companies, the big guys, right? The big guys where policies might actually come into play and mean something. Now, I know the Susan G. Komen Foundation throws a lot of money at this. How are we trying to manipulate this? How are we trying to make this better?
Well, with policy play an important role in any systems change, regardless of any topic, chronic illness. How the system is built will allow for better access, better education, and some of the policies that we are working towards is around screening and diagnostics, right? That is a challenge, which is very expensive. And there's so many barriers to accessing that. So we have we're always advocating for various policies around breast cancer health and better health. We have, for our Black community, we have our Speak Truth to Power, where we bring together advocates to talk about those challenges in our Black community for breast cancer care, and what policies that we can align to go after, to advocate, to make sure that these policies are equitable and promote health equity for all, instead of just one population being benefiting from this policy, instead of everyone being benefited from the policies. So we're continuously working towards doing that.
I'm going to throw a personal opinion out there, because it's just as a surgeon who deals a lot with this. I don't know that this is true, but I would love to hear back from you at some point if we get to nail this down. You just said something that's very, very important. A lot of the policies we're talking about has to do with screening and diagnostic capabilities. I believe it is definitely a true fact that we are catching breast cancers earlier. And therefore their survivability, and you can look this up, actually, Susan G. Komen Foundation, you can look this up. If you are diagnosed with a stage 1 or 2, you have a very great chance of survivals past 5 years. I mean, if it's stage 1, you're looking at like 98%, great survival rates. I would argue that maybe this disparity of 40% more mortality in Black women might come from a lack of screening and diagnostic early, and therefore catching cancers later. And then, of course, there's so many other things like lack of care, lack of education, it being ignored. I think that has a significant amount to do with it. I know that you guys have coupled with a lot of societies, like the American Society of Oncologists and other things, to actually kind of get these policies rolling. Is that right?
Yes, we're working with different organizations. What we're doing with a lot of our policy to making sure that it's equitable, we're working to expand government funding for breast cancer research as well, and also supporting an increase for education and the use and access for clinical trials for all patients and population, because that's also been found to be a disparity where we are not involved. Black women are not involved in a lot of the clinical trials that are out there.
Sure.
And one of the things that is found is that we're not being asked. That's the overall perception that we found is it's available, but we're not asked. And if we're asked, then giving us the option to say yes or no. But that is one of the biggest inequities, where the clinical trials are not part of our group as well. So it's a disparity in that area as well.
So how do you ask Black women? Like, how do you do that? Yeah. But I mean, if you're supposed to be a researcher or an organization and you're supposed to be blind to color, right? You're supposed to be. And we're just asking, hey, women, would you like to be a part of this clinical trial? But there's a massive disparity there. And we're saying we're not asking. So I'm asking you, how do we ask Black women? How do we do that? How do we approach Black women in general? Is it the campaigns like you guys do? Is it, phone calls? What do we do?
Yes, I mean, if, for example, if a Black woman come into your office, I always talk about patient-centered care, treating them as an individual, seeing them as a person-centered care, and seeing them and just having those conversations. If they're diagnosed, if their mammograms came back abnormal, giving them options, making sure to sit down and having those conversations where there are options, where these are some clinical trials that are happening in your community that is happening, this may help. Just being able to educate them on their options is helpful. I've had lots of conversation where and even it personally had happened to me, where I'm giving a diagnosis and then I'm just dismissed, and all of the other things I had to find out on my own. And with my level of education, I'm able to do that, to just do my own research. But I always think about the person who doesn't have that kind of access, what it would look like for them. And that's what drives my work, because knowing that, hey, this is an option for me and I was never told, sometimes it breaks my heart, because it's just, hey, this is your diagnosis, these are the options, chemo, blah, blah, blah. But there was never any mention of being part of a clinical trial that may improve your prognosis moving forward. So I think seeing the person as a person and asking them, hey, giving them the education and their option. And if they decide, yes, I will like to find out more, but what I've noticed is that there's not much conversations around clinical trial, because there's an assumption of, hey, you might not be interested in do it, or maybe physicians or whomever may not have time to sit down and explain in detail about such challenges. But how do we communicate that a little bit better to
you just hit so many, you hit so many things. It's unbelievable. So time, you're correct. I mean, we're pushed, right? When reimbursements get less and less and less, physicians, I'll tell you the truth, we are pushed to get so many people in the office, move. I've done a million doc talks, and I've done a million postings and videos, and you can always go back and look at these, but 3 of them that I did addressed something I want to just empower people to do again. If you do not have a good relationship with your physician, you do not feel like they care about you as an individual, walk out the door and find somebody who loves you. It's okay. It's not that hard. Physicians, I will tell you, I still believe this in my heart. I do. I have to. I believe most doctors become doctors or physicians because they care. They genuinely want to take care of people. In fact, it's the reason why many of them just make up stuff. It's if they don't know, they want to know, and they want to know because they want to fix you. And that's okay. If that is true, if most people go into it because they care for people and they want to care for people, then when you walk out the door, you should feel educated and cared for. And if you don't, go find somebody who does. Yeah. So I don't know if you believe in that, but I do.
I definitely agree with that. I agree that, yes, you have to find someone you're comfortable speaking with and get a second opinion, because if you don't feel comfortable talking about
Right on.
your issues, then that's not the doctor for you, right?
Mhm.
So, and one of the things that also was also a challenge that we've noticed is health literacy, having to be able to explain certain terminology. Breast cancer is challenging. It's
Yes,
a
it is.
heavy topic. So being diagnosed and telling someone that, hey, you have breast cancer, nothing else, no one, you don't hear anything else.
That's right. You don't. You totally don't.
It's just, white noise after that. But what I like about our programs, because we do have our patient navigators that are virtual.
Oh, that's awesome.
You're
Yes.
able to navigate someone who's been diagnosed, a patient, for any resources that they need across the United States, to be able to hold their hands, provide that support throughout their breast cancer journey for whatever resources that they may need, because that is a big challenge for anyone who's diagnosed with breast cancer, right? Being able to figure out the next step. So when you're trying to figure out the next step, I just adore patient navigators and community health workers, because they play an integral role in providing those resources for patients who are in need and don't know where to go for the next step. So
That was something I was going to hit on when we get to Stand for Her, which we're about to move into, because when I saw that you have personal navigators, that is something we've just figured out in medicine. Unfortunately, we're just figuring out that, hey, maybe somebody could hold the patient's hand and guide them through this mess that they've just entered into unwillingly, right? They didn't ask for their diagnosis of anything, right? So, and now you're right. I mean, you're not hearing much. That's why you should always bring a loved one with you to your appointments. They're going to help you hear this. That is so, so, so important. But I wanted to get your opinion on something, because this is something, obviously, this is your passion. This is what you do. And inequities is the biggest part of it. But we're talking about inequities with respect to screening, inequities with respect to physician care, inequities with respect to education, inequities with respect to treatment, inequities with respect to clinical trials. What we're talking about is a health equity revolution.
yes.
What does that look like? And I know we've talked a lot about it, but I want you to give me a bullet list. Give me just bam, bam, bam. What does that look like to you?
For me, health equity revolution, where everyone come together to help, save the lives of our Black women, breast cancer patients in our Black community. And that involves outreach and campaign designs. That involves partnerships and with community organization, healthcare providers, our research scientists, policymakers, our community members, everyone coming together to try to address all of these inequities, because there's a lot, right? There's so much.
Yeah, there is.
One organization cannot do it alone. So let's get together, bring us all together. Let's have conversations and develop solutions on how we can address these inequities that are killing Black women across the board. And that is my vision for this program, because I call it Stand for Her, because we're standing for you. And it's a health equity revolution. Everyone comes together and we're to leverage all of these resources that's out there, because we're all doing similar work, right? All of us are trying to make life better, help people live longer lives, but how can we come together to be able to address these barriers? Because if for those who don't know what health equity means, it means that everyone has a just opportunity to be as healthy as possible. And this requires the removal of barriers to care, removal of any barriers that are impeding care. So how do we work together to get that done? And I'm passionate about health equity, because there's so much work to be done, and all of us need to be part of this. It's not just one organization, but everyone. Doctors, physicians.
This is not the Black community saving the Black community. This is everyone get on board, right? And I will tell you, Education is such a piece. I will admit to you my ignorance as a physician and as a surgeon. If you don't know, a white woman and a black woman walk into my office, the same diagnosis, and I don't recognize that there are inequities, there are this massive disparity, then I'm, even if I say, hey, I'm a good person, I'm a physician, I treat everybody the same, well, they're going to get the same treatment. But I didn't recognize that there are barriers and blockades to a group of people that don't necessarily hold up in the other category. And if I don't know that, then I'm not doing anything about it, right? You can't just turn your eye to this and pretend it doesn't exist. A number like 40% is such a drastic number that you have to reckon, you have to stand up and recognize that, okay, something is wrong here. And I cannot just treat these two groups the same. I have to recognize there's a massive disparity. Where are the blockades for my patients, for the country, for the world?
Yes.
You agree?
I do agree. You said it perfectly. And that is always my goal for, anyone who's treating a patient or anyone who has encountered someone of another race, ethnicity, and background, always thinking about what are those, it's not equality, because there's always a, those terms are getting mixed up with equity and equality. Equality, everyone is on the same playing field, right? Everyone gets the same thing. But equity means that some may need more than the other because they don't have those underlying those barriers that are affecting their health outcomes, lack of jobs, fair pay, quality of education, their housing, the environment plays a big role in their health outcomes, their health care. So when seeing, I like what you said, when you see a patient, don't look at them as equal, trying to understand what those inequities are, the why. I always call it the why. Why are they getting more sick? Why are they dying at a higher rate than this person? What is the underlying factors that are causing this? And those underlying factors are the inequities, are those social determinants of health that's causing the elevation or the disparities numbers to go up.
Right. I saw something that, and I just have to bring this up. It's a personal thing, so it's okay. If nobody else saw it, it's fine. I rarely see anything from like these YouTubes or whatever, but my kids are watching this YouTube thing the other day, and it hit me so hard. I had to sit down and we replayed it 3 times because my children are young and I needed them to understand this. I needed them to know this was true. It's a YouTube thing, look it up, where there was a bunch of black athletes and white athletes and then other white children lined up on a line. And the coach says, okay, we're going to have a race, 50-yard race, whatever it was. And he says, have you seen this?
Yes, I know that image.
It put it into such perspective that even my children, my 11, 9, and 7-year-old children understood this. If you don't understand what we're talking about, let me tell you what happens here. He says to all the kids, he says to all of them, he says, if you grew up with 2 parents in your home, take 10 steps forward. And he says, if you grew up with an income over this, if you grew up going to public school, if you grew up and you had lunches and you didn't have to go on a program, if you, and there were all these questions. And he says, okay, you guys ready to start the race? And so many of these white children were almost to the finish line before the race even started. And it's the white kids didn't do anything wrong. It wasn't that. It was that you got to recognize the disparity in front of your face. And so I don't know if you feel like that somehow relates, but I certainly do.
It does. That's a great example of saying we already have the starting line, right? And then all of these still things that are still holding others back from getting to the starting point. So how do we address those things to get them to the finish line, to get them to better health? And and that's what our Stand for Her is about, where we're addressing looking at those underlying factors. And it has to be evidence-based, because it needs to be something that we can see that this is working, right? So making sure that we understand the challenges, understanding the why, and then coming up with evidence-based solutions. Because I'm be honest with you, doctor, I'm tired talking about the problem. I'm just so tired.
You don't look tired. You're ready to go 10 more rounds. You're ready to go.
Yeah, it's been happening for so long, but I'm also elated that we're having this conversation to be able to bring awareness that this problem is happening, and it's happening to our Black women, and something needs to be done about it. And I think because Komen is doing something about it, that's why I'm so passionate about it, because we've taken the role of saying, this is a problem. This is a priority that we need to focus on, right? This community needs our help, and we need to figure out ways in which we can bring people together to help us solve this problem, because we can't do it alone.
So I'm going to talk about 2 questions that came in from some people, and then I'm going to move on. We've kind of talked about Stand for Her, but in bits and pieces, but I want to put it under one umbrella so that people, whoever hears this, understands there's something out there for them, and they can reach out and there's something available to them. But 2 questions. It says, Dr. Rad, does obesity increase the risk of breast cancer diagnosis? And then also, once diagnosed, does obesity change the survivor rate? That is a great question, right? Because obesity in this country is somewhere around 33%. So how can you can't just unmarry those 2 things.
Oh.
So yes, research would show that there's a 7-fold increase in breast cancer with obesity. And why? Well, breast cancer is kind of a special cancer. It is hormone driven. There are 2 areas where hormones come from, guys. One, ovaries, right? There's a lot of estrogen pouring out from ovaries. Where else is estrogen made? Excess fat. That are the only 2 major places estrogen is made. So these breast cancer tumors also feed off of estrogen a huge majority of the time. Not all the time, but there's estrogen receptors on these things that make them grow faster. So your next question was, once diagnosed, does obesity affect us? Yes, it does. More estrogen feeds these tumors. And so, yes, they do grow faster. So obesity is intimately related to breast cancer. And one of the other great questions I really love is, how much breast cancer education is shared in the schools? I don't know that there is any. Do you know of any, Doc?
No, I'm not. No, that's a really good question. From my schooling, I don't remember ever learning about breast cancer.
Yeah, but it's the #1 diagnosed cancer in the world, right?
So it's not being taught, and that's a really good question that we need to also start from younger age and having those discussions, right? And importance of mammography and early detection, and if you're not in the field, how do you know?
How do you know? How do you know? All right, so Stand for Her. And if you haven't figured it out yet, folks, HER is an acronym for Health Equity Revolution, which is what we're talking about. I wanted the most important thing, and you already mentioned it, and it's my favorite thing. Tell me about the navigator. What is a navigator's role? Let's say I am a Black woman and I've just diagnosed, and I only heard 50% of what my doctor said, and I come home and I've heard your name, I've heard Komen, I go onto your website. What happens after I call the number? What happens with this assistance?
Well, once they call our helpline, they're connected to, depending on their need, they're connected to one of our patient navigators. And we have navigators we have over 14 navigators in different cities. So depending on you, and they are Black navigators as well, and Hispanic navigators.
These are just random people, or they've been educated?
They're trained, they're highly trained, competent navigators who are able to navigate patients with whatever resources that they may need through the system. So they will connect them to holding their hand. They're calling, asking for help. If it's financial assistance that's required, we're able to assist them with that. They're going to hold their hands throughout their breast cancer journey and being that social support system that they need throughout their journey. And our navigators are wonderful because, again, they're patient-centered and they cater to those inequities. So if someone just called with just issues about, transportation challenges, right? That's a big barrier to care. How does Navigator help you to connect that? Understanding what doctors to go to, what screenings to go to. So our Navigator provide those resources for that patient and making sure that they have those conversations about what it is, educating them about their breast cancer health, providing all the necessary resources that the patient need at the time, not inundating them with too much, but as they
100%.
call, it just
100%.
walks them through their breast cancer journey, which is just amazing because it helps them to feel comfortable that they are able to call someone to help them with resources.
And for those of you who don't understand what the good Dr. Gordon-Rose is talking about, let me give you a 20-second download. Let me give you a preview of this, because most people aren't in medicine, right? Most people aren't in the health field like you. You get diagnosed with breast cancer. Let me explain what already happened. You had to drive to get one, you had to schedule a mammogram, and somebody had to tell you you had to do that above the age of 40, or if you have breast cancer in your family 10 years before that diagnosis, right? Then your doctor, typically, you can't just walk in and get a mammogram. You have to get to a doctor who has to give you a prescription or something. You go get your mammogram. Well, then they call you back. They call you back because they want to get some special views, right? And then all those special views, we don't really like that. We're going to get an ultrasound. Then you get to go back. Then you get to go for that ultrasound. Now it's a BI-RADS 4. We think we want a biopsy. So then you got to go back and get a biopsy, and that's insurance has to pay for that. And somebody has to okay that. Then they say, oh, well, this came back as funny. And a lot of times doctors are scared because they don't like giving bad news. So they send you to a surgeon and a oncologist and maybe a radiation oncologist. So now your team of doctors just grew to 4 or 5, and now you get to drive around to all of them. Then someone gives you a diagnosis. Now what? What do I do with this? Well, now you meet with them. Sometimes you need clearances. Sometimes you go to surgery. What surgery do I do? Who's talking to me about that? Do I need radiation? Do I not need radiation? Do I need chemotherapy? Who's talking to me about it? That's not even 20. That was 40 seconds of. And that was minimal, right? That was not even the whole story. And now I had the surgery. Now what? I had the chemo. Am I cured? 5-year survival rate? What does that mean? It doesn't stop at the surgery, even the treatments, right? It keeps going. And that's what I love about navigation. That is beautiful, because you've got the 800-pound gorilla. Komen has your back. There's this navigator going to help you through. And that's just a beautiful thing. Sorry I had to rant on that, but people don't know how sticky it gets.
Yes, it gets really, the system is really convoluted, especially when you're diagnosed with any chronic illness, right? Trying to figure out what's the next step. So this is where the navigators come in to say, hey, we got you. We got your hands. We're going to help you out. Don't worry. And it's really soothing to the patients to have that support alongside them. And it's the work that they do is amazing. And I could talk about them all day. And, because they play an integral part of following up and following through the patient.
Right. Another thing, following through. That's huge. Okay, so now we recognize that we got a navigator. We're helping you through. You said there could be some financial assistance for people who need it. Is that true?
Yes. So again, another barrier is financial, which is an inequity. If I can't pay for treatment, if I can't pay for simple things, I'm not going to be able to better my health. So what we're doing through our financial assistance program, we're trying to ease those financial burden, and we're providing daily living expenses associated with treatment for those who are eligible, those Black patients who are eligible who have breast cancer. So our connection point is our helpline. Once you call our helpline, we are able to connect you to any of these services, our navigation service, or our financial assistance as well. And, because the key is to make sure that the patient support and to connect them to timely, high quality care. So that's the key through our programs.
That is the key. So, okay, so Stand for Her is pushing for Black women to get more education, financial assistance, navigation, screening, access to doctors, access to treatment and access to clinical trials.
Yep.
Anything we're missing?
Workforce development,
Oh, bring it on. Bring it on. I love it.
It's
Bring
like,
it on.
wait, there's more.
Wait, there's more. I love it. All right, what does that mean? What does that mean?
So we're training and equipping and mobilizing Black patient navigators across the nation because this is such a good model, right?
Right.
So
I mean, you proved it worked in like big cities, right? So, and the equity, by the way, if you want to read the papers, go for it, but we'll do it for you. In some of these cities, the 10 cities that they started this program in, the disparity was somewhere in the realm of what, 74%? 74%. So they built the model in these areas first. And now what we're talking about, right, is expanding this thing into the country. Is that correct?
Yes. So our Stand for Her program is now a national program. So regardless if you're not in the 10 cities and you need services, we will provide those services to help to address your inequities. So through our workforce development, we're trying to improve diversity and cultural sensitivity of our healthcare workers. And in doing that, we're training healthcare workers through our Komen. We have this great module, racism and bias module for patient navigators. And this educates individuals of how Black people experience systemic racism and biases within the healthcare system. And if you have the chance to do it, Dr.Rad, I'll strongly recommend it to your team because it's amazing. It gives historical context to how Black people were treated in the healthcare system and bringing it to current and what to do if you encounter such biases in the healthcare system with a physician or vice versa, how to address something like that. So it's amazing training that we're providing, but we're also providing culturally responsive navigation training. So we call it a navigation nation, where we want everyone to have a navigator to help, to help to navigate them through this convoluted healthcare system that we have and to be able to get better health outcomes for our patients.
Man, wow, there's so much to be said there, but I will tell you, I will take the Pepsi challenge. I will do the module because when I said that you don't know what you don't know, I will tell you, as a white man, right? As a white man and a physician, I would never dream that even I have bias against any of my patients, but that's not true. It can't be true, right? It can't be true. There has to be some. All of us have it. Some of it built in from hundreds of years. Some of it's built in generational. Some of it's built in genetically. Some of it's built in just because I grew up in West Virginia. Some of it's built in, for many reasons. You don't know what you don't know. And if you don't know your history and where you came from and how this all happened, well, then you're lost. You got to go back. You got to figure it out. So if that model does what you say it does, then I think it should be mandatory. And I think you guys should try to make it on, a mandatory CME for every state in this country.
Yeah, it's on our website, so anyone could have access to that training if they're willing to do that particular training.
Mandatory.
I love mandatory. So we're going to try to be able to say
that's it. It should be.
Go out and take this training because I took it, right? And I'm a Black woman.
How did it go?
It was emotional for me because it's just, lived experiences, the differences. And I always want to see how, after you take it, we could have a conversation to see how.
We're going to have to.
Because it's funny that you mentioned bias, because in our research, implicit bias was one of the things that a lot of the participants mentioned that they experienced. Define implicit bias? Because that's very, very important for people listening. Define that for us. So they feel that, they're treated differently in the healthcare setting because of their race and the perception their provider may have about them. So it's not a conscious thing, but as you said, everyone has biases, right? So it's basically isn't a subconscious thing that becomes conscious in the treatment while treating a patient.
That's it.
You know, it's not something that you're aware of it, but some of the how they're spoken to, how they are treated, how, you know, by the color of their skin, with the perception that, oh, Black women doesn't feel pain, right? That's always one of those things so we're not being taken seriously in the healthcare setting when complaining about pain. So that is one of the implicit biases that's been encountered, and based on their race, and and some of them also complain about harsh, compassionate, painful treatment at the hands of providers. So that always breaks my heart because I've experienced it, right? And again, the implicit biases are there where we don't feel pain, but we do feel pain. We're hurting like everyone else. We're human. So trying to work through all of that, and that going back to our racism and bias training, it addresses all of that, and where that implicit bias may come from, from the studies back in the days where they, tested on Black women, tested a lot of the drugs
100%.
on Black people, and the, the Tuskegee experiments, the Henrietta Lack experiment. So it covers all of those historical contexts, but then what it does, it brings it to the current on how to recognize that, and the solution to how to resolve that, if you're faced with something like that. So it's just.
And I love it. I love it because, it's interesting, as a man, right? As a man, it has only recently become okay for men to show emotion or be vulnerable. We're supposed to be tough too, right? And I can tell you that, when I'm faced with male patients with cancers, we sometimes break down in my office, but it's funny. They have to dry their tears and toughen up before they walk out the door, because then again, they're going right back out there. Right. And so I get what you're saying. 100%. All right. I want to ask you one more question, because we're coming up on an hour, and we're obviously going to have to do this again, because I'm going to do this module, and I am excited because it's funny. It's like you're anxious about what it's going to show you about yourself too, right? It's good stuff. And that's called growth, in my opinion. So that's what we're going to do. My question to you is, if you had one wish, you maybe two, I'll give you two. If you had a wish for healthcare in this country with respect to Black women, now it can be just breast cancer, or it can be just healthcare in general. You had one wish, and it was going to come true, what would it be?
Oh man.
I know, right? I'm going to nail you down. I know. I'll give you two. I'll give you two if you want to.
My one wish, one of my two wishes will be to make sure that we have better healthcare to fund these illnesses, because it's, we're diagnosed, and then there's all of these other burdens. How can we address all those underlying factors? So making sure to see the woman, I always want to see the patient as a whole person, and being able to treat the whole person, and regardless of what those whys are, just treat it. She doesn't have transportation here, money to transportation to get to your treatment here. You have housing challenges here, we have resources for your housing. So the last thing that they should worry about is their health, because all of those things are taken care of, and they could live optimum life, right? That's my dream.
There you go. There you go.
It's my dream to just.
Man, that's a dream. I love it. Yes. I love it. I hope the right people hear that. I hope the right people hear that.
And my second is to.
Oh, here it comes. I knew it.
My second, again, policies, equitable policies that's inclusive of everyone, and building those systems, changing the systems, and having conversations to change the system. And because health equity is an uncomfortable conversation, and I mentioned this to you. Talking about racism, talking about biases, talking about all these things are uncomfortable for some people, but wanting to see more people get involved, more people to drive policy changes and demand these changes that are killing us, that are killing our people. So that is my second thing.
100%. So you nailed it. We always there's these little sayings in life that you pick up on, like, you know, if you want to get after it, get at the root of the cause, right? And so what your wish list just did was you went to the root, right? There's financials, there's Capitol Hill type stuff, / healthcare administration, insurance companies, things like that. Get after the policies. There's 3 areas, in my opinion. So family starts at home. Let's talk about it. Let's talk about it. 2, education. You know, that question about schools, I never even thought about that.
Yeah.
Why don't we start there? You know, why not? Education is huge. And lastly, the policies, because you know what, if people aren't motivated to do it individually, then let's just do it as a people.
Collectively, yeah.
Collectively. I like that. I love that. All right. I want to throw out a few phone numbers if it's okay with you. So 1-800-877-GO-KOMEN. That's KOMEN. Does that sound right?
Yes.
That is a number you can call if you are scared, you need assistance, you have a new diagnosis of breast cancer, your friend has a new diagnosis of cancer. I don't care. Call and get some help, because they have nothing but information for you, right? And it's free. It's free. It's free. And then the last, if you're an email kind of person, it's just helpline@komen.org. And those are the 2 ways that I know, like right off the bat, to get to you guys. And I'm sure there's online sources and all kinds of other stuff.
Yes. And I also want to mention 2 more things. We're also doing screening and diagnostic. We have a screening and diagnostic program for the Black community where, you know, if they call the helpline, they'll be connected to that as well. So the screening and diagnostic is free as well. They're able to get access to that. Early screening, early detection is key because it is breast cancer month. So make sure you get your screenings done. We're also doing genetic counseling and testing, which, you know, we found that that's important in the Black community to understand the importance of genetic counseling and testing. So we are also providing those services. We've partnered with organizations and systems to be able to provide that important information, and we're developing genetic counseling and testing, tailored educational materials for the Black community to understand why and how understanding your genes is important for breast cancer.
You know, that is so important, because what if somebody, you know, says, you know, they hear this cast and they go, well, my aunt Jean had breast cancer. What are my chances? Well, I'm 40. Should I go get my screening? It's a phone call away. They'll set you up with screening, talk about your genetic outcomes. What are your chances? That is so important. And as I have always done in the month of October and throughout the year, I don't care who you are or where you live. If you need a prescription for a mammogram, you call my office. Just go to myradbody.com. My number's there. I will send the prescription anywhere you want it to go. So God bless you, Doc. And thank you so much for your time. And God bless the Susan G. Komen Foundation. You guys, great work.
I enjoyed this. Thank you so much.
God bless you. Good night. Thank you, guys. And share. Have a good one, guys.